I'm Rimma Boshernitsan, the founder and CEO of Dialogue. Welcome to 10 by 20, a series of 10 questions discussed in 20-minute dialogues with local and international leaders doing visionary work at the intersection of people, technology, and society. Hello, everyone. I'm excited to introduce today's guest, Sonia Millsom. Sonia is a healthcare industry veteran, passionate about implementing institutional change and innovation. Most recently, Sonia served as the Chief Commercial Officer at Maven Clinic, where she led all aspects of revenue growth, marketing, sales, and client success. She recently joined the board of Clever Health, a startup Medicare Advantage plan that provides culturally sensitive solutions to seniors. And she's also a mom of 2 teenage girls, always growing the next generation of female leaders. Welcome, Sonia.
Thank you so much for having me.
What's influenced your work and how did you grow up? Tell us a little bit about your background.
Yeah, absolutely. It's funny to reflect on, kind of how you grew up, but I actually am the daughter of immigrants. My parents came here almost 50 years ago from India. And, I think immigrants are the ultimate entrepreneurs, right? They have no roadmap. They're kind of figuring it out as they go. And that's very much what my parents did. I'm incredibly thankful for all the opportunities that they gave to us in this country. And, my dad also is a physician. And so got a lot of exposure early on around healthcare and what that looks like and what it was like from a provider point of view and taking care of patients. They also had the whole aspect around kind of hard work and really being thoughtful and caring for people that were less fortunate than us, right? We were pretty blessed in many ways. And there are many examples of, where my parents took the time to take care of family friends, and take them to the hospital or bring them into our home and take care of them when they were recovering and just, being really thoughtful around that. I think also as I got older and I graduated from college, I got the chance to go to the Peace Corps. And for those who don't know, the Peace Corps is, you take 2.5 years and you live in different places. And for me, that was in a rural village in Morocco in the Middle Atlas Mountains. And I got to see firsthand as a maternal child health Peace Corps volunteer what it was like to have a really, challenging infrastructure. I saw both birth and death of babies because of the way that the system was set up. And it was really impactful for me. And being able to think about, how is it that I think about delivery system reform? And essentially, how do you really bring people along in order to make change, right? You have years and years of culture. And how is it that you think about making change across with people to make a real difference?
Yeah, no, that's so interesting. I feel like it's funny. I mean, I'm also part of, I also immigrated here with my parents in their 30 plus years ago at this point. And also seeing them make something of their life that's different than the life that they had and hold space for the family in a way that when the most amount of stress, I mean, it's unimaginable. Sometimes I think about my stress now and I'm like, but it wasn't as bad as that. It wasn't as bad as having to like literally in your 40s immigrate into a completely new system, a completely new way of living, and then start from nothing. So I think it also shapes us as children of immigrants in a way, even though we're immigrants ourselves, in thinking more humbly about some of these things that you mentioned, right? Some of the helping, the understanding, the empathy that really exists to sort of bring your vision to what you're seeing as care and what you're seeing as like the thing needs to be done for the most amount of impact in the moment that you're trying to create it. Yeah. And so it sounds like you're like when you were growing up, you're fairly close with your parents. Would you say that they've shaped tremendously like how your worldview is shaped now? Or is there other kind of factors that kind of happened along that also shaped your worldview?
Yeah, absolutely. I mean, I think, again, coming from a really traditional, strict background of like where they grew up and coming here and, particularly the parents of like daughters, that my parents were just like, follow your own dream, right? I think I'm probably one of very few, Indian daughters who didn't have a doctor, who didn't become a doctor, right? And now, that was like very the same. They just always told us to follow our own path and do what we can and learn from others, and really be open and curious around what's around you. And that is very much, shaped. And as I mentioned, even taking the chance after college to go into the Peace Corps. I mean, to go into a rural village and just live there and, not know exactly how it was going to work and in what way, shape, or form, it's given me a lot of opportunities to just say, like, I'm happy to make a choice, sometimes not knowing what it's going to end up like. And again, be really curious around what that could be.
Yeah. Well, I'm really curious. Is your sister a doctor?
So I have two sisters, and none of us are doctors. I'm in healthcare. I have one who's an attorney in real estate, and then the other one's in education. So we've all done kind of different aspects of different systems. But yeah, I mean, I think there's, again, core values around caring and helping others, but none of us became physicians, which I think, again, is really unusual, and coming from an Indian family with a doctor in it.
Yeah. And your dad had to like when he immigrated, he probably had to get his credentials. Like he had to go back to medical school here, right? So he did like 2 bouts of that.
He didn't have to do medical school over again, but he did all of his internships and residencies and everything here. And so he actually practiced at some of the most amazing places in this country. He trained at the Cleveland Clinic and the Mayo Clinic, and he taught at Dartmouth for a while. And then ultimately, kind of went off of the path of like the big names, because he really cared about patients. And so ended up doing most of his career in smaller areas in York, Pennsylvania, or Oshkosh, Wisconsin, and just being really close to his patients on a day-to-day basis and operating. That's what he really enjoyed. He's a heart surgeon. So
yeah. Oh wow, that's amazing. So how often do you talk to him about the work that you were doing at Maven and other other organizations before?
Yeah, it's a great question. We actually talk pretty often. He transitioned from a physician into becoming a coach. So he actually went and got a coaching certificate when he retired from becoming a physician. And so he likes to still coach and mentor. But I think he also, again, he just likes to listen and learn. He talks to lots of people in healthcare in the business area. And he also, is still a great sounding board for me as I'm thinking through transitions or other things about, how to approach, and particularly, again, from the perspective of a physician, and really being in the system on the day-to-day and what that looks like. And I'm kind of always coming at it from a business perspective. So those combination of conversations are really helpful.
Absolutely. Oh, that's amazing. God, I would be such a different person if my dad was a coach or had the ability to be a coach. It's amazing. Or my mother. That's even more impressive.
Well, I think it's still like any child and parent relationship. You want to take advice from others sometimes, not always from your parents. So there's still some of that tension there.
No, for sure. And so I know, I mean, it sounds like your dad's been an amazing inspiration, and generally feels like you guys are the family, like it's so much about the service part of what can we do, what can we help, how can we help, and where's the that sort of like opportunity to help the other kind of be included in something. I'm curious, like for you over the years, what are some of the big questions that you've been passionate about that you've answered or are answering or want to answer through your work?
Yeah, it's a great question. I think that there's this great quote from Hubert Humphrey, which is about saying, the elderly and the quality of their lives is really the measure of a quality of a nation. And I think that has been, the way that I think about where are there problems, both kind of in senior populations, as well as now where I've been focused most recently, with my work at Maven in birth, where 50% of all births in this country take place in Medicaid. And really, how is it that we invest appropriately there? And so, in going back to my Peace Corps days, that's really kind of what started that. But then having the ability to really see across the entire healthcare system where there are problems, where there are opportunities. We've seen a lot of investments that have been made on the end of life. We're seeing a lot in Medicare Advantage. We're seeing a lot around senior populations, new models of primary care, like the work I did when I was at Iora, which was amazing to see the difference that can really make in people's day-to-day lives and outcomes. But it also just became, I've really loved to see the other end of it. I think there's still so much more opportunity at the beginning of life and the investments that we can make there. And, we have a country that has the highest rate of maternal mortality of any developed country in the world and continues to rise. A Black woman is more likely to die in childbirth than, a white woman. And it is, 100% more risky to deliver a baby than it was for our parents, a generation ago. And so we've got to do something about that. It's a challenge that we have to address as a country if we want to continue to progress. And I think that came to bear even more so during COVID, where you really saw the challenges around access and health equality come full circle. and in terms of what we saw and just the reality of people being able to access the care that they desperately needed.
Yeah. What are some of the things, I'm just curious, the early risk, kind of the risks that you're seeing now that 10 years ago or 30 years ago didn't exist at all in the early childhood or early maternity sort of time frame?
Yeah. Well, I think first and foremost, we're still using, a prenatal set of care checklist that was over 100 years old.
Mhm.
And if you go back to that time, people delivered babies in their homes, even in Morocco, and the Peace Corps volunteer, as a Peace Corps volunteer, like we had a maternity, but most often people were delivering in their home. And that wasn't a huge medical intervention. Now we are delivering in the hospital. You see this huge increase in the rates of C-sections, just the use of medical intervention versus the reality of having, again, the appropriate levels of service at that time, just during the birth. But then even more importantly, it's really around prenatal care, right? Thinking about health literacy, thinking about nutrition, thinking about education, just those basics that allow people to be more supported throughout that entire journey. And, just bringing a lot of those different elements together. I think the other piece that's huge is really around mental health. I mean, it's incredibly stressful as you're going through pregnancy, and particularly in postpartum. We know that is where we see so much depression. We see the challenge around comorbidities there too, and just the reality of that people are not getting the care that they need. It's so fragmented in the system that we're offering right now. And so there's so many opportunities, even from a policy level, like being able to tie women and their babies for a longer period of time, at least through the first year of life, ideally maybe even to age 3, that would really make a change in the way that care is being delivered, financial incentives are being aligned, and even the way that plans are operating on a Medicaid basis, throughout the country.
Oh yeah, gosh, it sounds like an ideal situation. I feel like our collective values have to change completely in this country for that to happen.
Yes.
And at the same time, it's interesting because we're fighting for, equal opportunity. And yet at the same time, like the ability to take a 3-year break just to be with your kid isn't going to be viewed as equal opportunity. Then you come back in a different place and so forth. And it's just so many different infrastructural things need to be adjusted for that to happen. And it's so unfortunate because I think probably during your time in the Peace Corps, you it's almost like you were, well, and a lot of times I just feel like you're going back to the core basics of what are the basic human needs that we need and how are we supposed to function in society, not even society, beyond in our environment and the thing as a species, right? And what do we really need and seeing that in a underdeveloped country and then coming here and seeing something completely different. And it's this need, I think, where I've been observing in my own experience in delivery and just being part of that whole process is the need to control, the constant need to control and to have power. And I don't even know that some physicians notice that they do this in this way, in the way that they interact with the patient and so forth. But it's such a minor, it's such a minor thing, but that if you if you allow it to influence you, it can have actually a really big hold on you as a mother, especially after after birth. And even if you don't have postpartum symptoms or depression, you still, I feel like I was during that moment of hormone, you have so many hormones running through you. I feel like you lose your sight of yourself. And if no one's there to support you and understand that part, even your significant other potentially, then what happens 2, 3 months, 5 months, 6 months later when you feel a particular way. So it's, it's just an interesting, such an interesting juxtaposition between what's happening outside of the US and what's happening in the US, and how when you try to be a little bit different, how that's viewed as well, both by your physician and others, and maybe even in my family, if I delivered at home, probably would be very scared for me. So I was I thought about doing it sort of in a birth center versus just a straight hospital, and not doing it at home specifically, but for other reasons. Anyway, but I love all of the thinking that's going into some of the things that you're passionate about, and I'm curious, beyond the work itself, and what's when do you do your most creative thinking, your most kind of the opportunity for you to be Sonia, and for you to kind of think about the things that you're passionate about, how you're going to take them forward.
Yeah. It's a great question. Just one comment too on what you said before. I think the other element that we need to do better at just overall like as a system is this trust. Because I think, whether you deliver at home or whether you deliver in a hospital, like all of those are choices, but ultimately it's about having the trust in the relationships that you're building with the healthcare system that allows you to make the right choices and ultimately have better outcomes because you have trust. And that's really what's missing in our system right now overall in terms of the ability to do that. But I think your question about, kind of when I feel like the most innovative, creative, I think there's a couple of different ways to answer that. I think, first and foremost, I like when there's no path, like there's no playbook. And I've often been at companies and built really diverse teams with different skill sets and not necessarily historically even coming from, healthcare, but like bringing different people together and saying, here's the problem we need to solve. And there's no like right answer. Let's go figure it out.
Mm-hmm.
And I've often been at companies that are in pivots and going from different lines of business or thinking about, inorganic or organic growth in different ways. And that's when I feel the most creative. And I love bringing really different types of people together to solve those problems. And when and really understanding deeply what their strengths are, and then saying like, okay, let's all sit down and like figure this out and hash it out and try it this way. It doesn't work. Try it a different way. It's really where I see amazing creativity, innovation, and performance. People will, put their heads through a wall in order to solve something when they feel like they're really actively engaged, both from the problem they're trying to solve and the people that they're trying to solve it with.
Yeah. Well, what I'm hearing too is that you're excited about the opportunity, like that moment of like opening where you can really take something to the next level of whatever it may be.
Yeah.
It's super exciting. I totally share that passion with you as well. And so how would you say human connection has shaped your work?
I mean, I care deeply about people. I care deeply about, my friends, my family. I'm not one of those people who has like thousands of friends, but I have the ones that I have are really dear to me. And even, many of those connections are people that I've made through work. And so I know that when I really care about people, and again, when they feel like I care about them and have that trust element, that's really where you see the most, again, creativity and innovation. And I like to really hire different people that complement my strengths, that complement each other. And I think ultimately what I really like about the human connection of work is that you see too, particularly in healthcare, where you're really thinking about people at their most vulnerable state, right? Their patients, they're trying to access a service for something that's happening, whether it's a childbirth or a senior that's just been going through a lot of challenges. And when you see that come together and they have that trust and they feel like they can take the next step in their behavior change, or like they have a better outcome just from a, systematic perspective, or they get cured, right? Or they get a different diagnosis. Yeah. That's really when you kind of see that human connection. And I think it's really, part of, again, building that trust in healthcare is making sure that you have that. We sometimes lack empathy, and, we have to think about it in the aspect of humanity in order for us to really make change.
Yeah, no, absolutely. Do you think that, how do you think that the past couple of years kind of affected that aspect of what you're seeing, sort of the relationship, the empathy between the provider and the patient?
Honestly, I think it's gotten worse. I mean, I actually had a personal situation where I had to go to the hospital a few weeks ago, and I was in pain, and, I felt like the workers around me were in pain, honestly. They were really challenged. It's really difficult. They've got tough patients. They're dealing with COVID. They're trying to get through everything. And so it's even harder to just you're wearing a mask, right? Which naturally then puts a barrier between you and the people that are trying to help you. I think it's gotten a lot worse. And I think we're building some muscle through these modems of where you're like, you can do things through telehealth and through other ways, but we still have work to do in order to really make a difference there. It's getting harder and harder, and you're seeing shortages of staff workers now in healthcare, in all industries, but in healthcare in particular, which I think is just going to put more and more pressure on the system.
Yeah, no, absolutely. I mean, I think the burnout piece of it for physicians is really real. I can't imagine like not having a choice, basically, unless you just choose to go on sabbatical from work. No, it's very tough.
Yeah,
So
not just physicians, but the entire team, right? I mean, it's the
yeah,
nurses, it's the
yeah,
caregivers, it's the even the people who move your bed from one place to another. I mean, it is everybody is just burnt out, and it has an impact on the care that's being delivered.
yeah, no, absolutely. If you zoom out into kind of the like a top kind of a top down view of the of what's happening in the healthcare industry right now, what are like maybe what's the one thing that you'd love to see change, like completely, but whether it's early, early stage maternity or prenatal or end of life kind of or anything in between.
Yeah, I think for me, the biggest piece would be just, first of all, value-based care is here,
Mhm.
right? So being paid based on outcomes versus fee for service. Again, there's been a lot of shift in that in the Medicare space. There's more and more of it taking place on commercial. I think we have to do more of that in the Medicaid space. And I think having that really thoughtful approach of having mom and baby be connected from the very beginning through the entire episode of what's happening through that first year of life, we have to make that happen in all of the aspects of care and policy on a state by state basis and on a federal level. I think that's, what we need to do. I think that's the only time, when you really see the financial as well as the clinical and then also the actual, patient impact, like the
Mhm.
satisfaction, you combine those elements, that's where you see real change. And that's
Yeah,
what we need to do in that at that end of the scale. We're seeing it in Medicare, but we need to do more of it in Medicaid.
yeah, yeah, absolutely. Well, I just think again, it's rethinking what our values are and how are we leading with those values as a country. Yeah. Are you ready for some rapid fire
I am.
questions? Okay. So when do you feel most connected to others?
My favorite place to be is around the dinner table after having
Mm,
cooked a meal, wine, hanging out. That is like my favorite time when I feel very connected to people.
mm. When and where are you happiest?
When I'm with my family and we're in a new place,
Mm,
traveling to Iceland, going to India, going anywhere, even for a hike.
yeah. What intersections of disciplines are you currently most fascinated by?
The intersections between healthcare, technology, and education.
Mm,
Thinking about how those things combine, broadband access, the impact it has on those three sectors, that's really where I'm the most fascinated.
that's awesome. What's your greatest regret?
I think my greatest regret is when my youngest daughter was born and not taking more time. My mother in law actually passed away when I was on maternity leave, and our entire family was grieving. And
Mm,
I just, I kind of plowed through it. I'm a push through it person, and I think I wish I hadn't pushed through it as quickly.
yeah. Oh, I hear you on that. I'm also a push through person. Doesn't serve me in the end. What's the one thing you wish to pass down to the next generation?
I think we need to learn how to listen more. I think we're in this place where everybody just talks at each other and they don't listen. And you have to be able to observe and understand other people's points of view in order to be more informed.
Yeah, I totally agree with that. Thank you. Thank you, Sonia. So good to have you.
Absolutely. Thank you so much for having me. I really appreciate it. It's been so fun.
It's so fun.
Thanks for tuning in to Dialogue's 10 by 20 interview series, where we ask 10 questions in 20 minutes to profile international leaders working at the intersection of people, technology, and society. That's all for today's episode. Like and subscribe below to get notified for our upcoming interviews. Follow us on Instagram at dialogue_co.